Hello, and thanks for listening to the Conscious Diva podcast. I'm Tatiana, and in today's episode, we explore the unseen layers of surgery where body, spirit, and intention quietly meet. Once again, I'm joined by Amelia Vogler, an energy medicine specialist and surgical consultant whose work offers energetic and soul level support alongside the medical process. This is not psychic surgery, but a deeply intentional way of preparing the energy body for an operation and supporting integration and healing afterwards. Drawing on advanced energy medicine, medical intuition, and trauma-informed care, Amelia helps individuals feel centered, held, and aligned during one of life's most vulnerable thresholds. We speak about easing fear, preparing the spirit, and how gentle energetic support can guide the body towards smoother, more integrated recovery and a faster healing time. This is a deeply grounding, quietly powerful episode for anyone facing surgery, supporting a loved one, or simply curious about the unseen layers of healing. I hope this episode offered you a new way of seeing what's possible. If it resonated, please feel free to share and write a review. And you can also follow me on Instagram and YouTube at The Conscious Diva. Thank you so much for listening. Amelia, it's so great to see you, and thank you so much for coming back on my show.
Thanks, Tatiana. It's going to be a great talk again, and I just adore you. So it's just a pleasure.
Awesome. So if anybody wants to listen to the previous episode, it is number 38, and that's called The Architecture of Your Soul with Amelia Volger. And in this episode, we're going to be talking about psychic surgery, right? Or preparing, not necessarily psychic surgery, preparing using energy for a physical surgery.
That's right. That's right.
Okay, so let's remind people what you do.
So I love that you introduced the first show, The Architecture of the Soul, because there's a very special energy system known as the hara, Hara, and the hara has roots, ancient roots in the traditional Chinese medicine system, although not named for thousands of years, this idea of a central channel that helps us to come here and embody here. We see the hara referenced in the art of the warrior. Being in your hara means being in the center of self. So it's this like really coming soul first into the world. And then we see the hara in Japanese culture. Hara actually translates to the belly, which is not like the digestion, but it's like the essence of being. So that little historical sojourn was to say, what I'm doing is I specialize in the soul and embodiment and the architecture of who you are and how you are. And surgery became sort of it kind of came to me, it was one of those paths that I didn't seek out, but I sort of arrived on the road looking around going, I belong on this path and in this sort of alignment with soul, because if we think of our essence and how it was that we were architected to embody all the gifts we have, all the stories we have, our ancestry, all the things, and then we get confronted with an opportunity to go through a vision quest like a surgery, where that essence of you and the relationship to the body is going to be changed in some way. You're going to go under anesthesia, relinquish control, and wake up different.
Mm.
And that's a huge leap for the soul. And so I started paying attention to that. We can talk about how and why and all the things, but that's really where I arrived, in a very special little place in my practice of supporting people through that transformation and sort of a transconfiguration of self into new self. Working with the trauma, working with the concerns, working with alignments, working with vision. So it's not just before surgery, it's during surgery and it's after surgery. So it weaves in. I sort of talk about it like it's my Olympics, because I get to pull just everything, that everything that we need, we have. And that's so true in this work for myself. It's like, oh, I do have that skill. Oh, I can see in the body. Oh, We can do medical intuition. Oh, we will look at ancestry. Oh, let's do some somatic work. So, anyway, we'll get there. But in essence, I like to support the soul of us and our connection to soul so that we feel home in ourselves no matter where we are and what we're facing.
As you were speaking, I was thinking about the soul journey and being in the embodiment in this lifetime. And so, have you come across something where, say, if a person, a client, it's part of their soul journey to have this because whatever's come up, and it's a tricky sort of question to ask because I wondered if on a soul journey in this lifetime you're getting sick or you're requiring the surgery or whatever it is, because that actually there's a lesson to be learned in that from this point of view with the soul, or is it something that the surgery is required because perhaps it manifested at this time for a person and therefore whatever it is they need to have, removed or altered or, supported in a physical manner through actual, surgery with doctors. And so I was really wondering when are you communicating with the soul? Because I know in our last conversation we talked so much, and that was a couple of years ago now, and we talked a lot about our life's purpose, dropping in through the hara, as you described, this beautiful realm of light that beams, comes right down. And I also can see that too, as this incredible, almost selenite-like translucency, this the how it is, and the size of it can vary depending on where the person is in their evolution in this lifetime. So how do you explain that? Is it related to karma? Is it related to past lives? And can you communicate on a soul level to kind of ease what's happening in the physical body?
So I think it's an enormously important question, and it has, of course, many answers. It's going to depend.
God.
It's going to depend on what the individual soul journey looks like. So let me give an example of a knee surgery that was done in January or February of this year. It was a knee replacement. This particular individual was healing ancestral stories through the mother line, and she was ready to walk in a new way.
Mm.
And so it wasn't just the physical restrictions and constrictions of her knee in the physical world, but it was those constrictions and restrictions that led her into the surgical path. And those were things that she was born with. So it was an inheritance that she was walking with that became too limiting for her, which in the physical lined up exactly parallel with the ancestral story, the soul story, the karmic story. So, it depends on the orientation that we want to look at. I think here we really probably all of your listeners acknowledge there's an energetic component. There's a larger story that's happening here. There are some people, like a car accident, things that come suddenly that don't seem planned. There is free will here. Sometimes those can be catalysts for change, whether it was divined and destined in that karmic path. I don't know. I try to stay a little bit farther away from really naming that, just because the mystery it's so important to acknowledge the mysterious forces that are in the great web. That's, there's always a bigger story. So there is a story. And then there's the way that I got into this work was through someone very, very close to me who had body dysmorphia. And that was certainly a soul story. This was like a conflict that kept this individual looking at himself in a way that he couldn't see essence. And he would go through surgeries, elective surgeries,
Mm.
10 of them, I think, now, to try to fix what was really showing up as a different solution if he looked deeper.
Mm.
So it's just it really depends. And I think I have
Well, I
never
have a quick
done.
question.
Oh yeah, sure.
In that example, and then I want to also just come back to the knee surgery for a sec.
Of
But in
course.
the example of body dysmorphia, where a person is seeing not their true essence, but they're constantly having surgeries potentially to alter their physical appearance. How did he come to work with you as a friend? Did he say, I'm really feeling this, or did you bring it up and then have a go through and maybe just walk us through what a kind of session for this example looks like?
Sure. So that's such a great question. Thanks. And interrupt me anytime. I just get on a roll. So just stop me anytime. This particular person I have known for a long time, very, very close to our family. And he knew that I had gifts in this area, but didn't know what it was called and didn't know because this has been something that I've been with since I was little. And along the way, he would go into surgery and I would just say, "Hey, do you want me to help? Do you want me to hold your feet? Do you want me to keep you grounded? Do you want me to, just kind of be with you there? Just stand with you, support you?" He's who doesn't want that, when they're going into surgery? And he said, always said yes. And because it's a long relationship, he also was sort of the benefit of my technical education, in quotes, like going through Healing Touch program, which is an energy modality that was intuited by a nurse. And so it's very aligned with the clinical nursing background. So it's a lot of pain management, anesthetic removal, wound support. So along the way, I kept integrating as my toolkit would grow. He would kind of say, "What else you got?" And we just traveled together. I never thought that I would be doing this as a specialty. That was a time in my life where I thought, well, I'm just giving what I can in service. But little did I know, I was learning along the way.
Well, were you able to support him in his soul's journey to arrive at a place where he doesn't need to, he recognizes, I'm great the way I am, I'm perfect as I am, I don't need to continue having surgeries, altering my appearance?
So for this particular person, because he's a friend, he never hired me explicitly to be in the conversation of soul work. And so, ethically, for me, it was kind of working in the gift of the space that he was comfortable in, that he was ready for. So for this particular client, or friend, really, he's in a place where I think he has learned a lot through the process. He can name things in a different way, but I think that's his personal work. I can't, I don't want to claim support in that area. Perhaps along the way, some of the work we've done together has helped him, but I'm not in connection in that way with this particular person to really speak to that in an
I
honest
understand.
way.
Well,
Yeah.
so the client with the knee surgery, she's a
Yeah.
client, right?
Yeah,
And
absolutely.
so maybe talk to the point how, because you said manifestation. So you said, and to be clear, how we're not manifesting the life of our dreams here. It's the
Yeah,
manifestation
yeah.
of things that we've brought through, elements we haven't confronted or dealt with that can manifest as actual physical things in the body. And so, can you just explain how the knee, something that manifests in the knee, is quite literal of the representation of we can't move forward anymore? And so it can perhaps, and then the body actually carries that energy, that signature in different areas. We carry in our shoulders and our necks and our lower back and the stomach and the hips, all different kinds of things, the head even.
Yeah.
So just walk us through that a little bit and then bring it back to the knee and how you were able to perhaps speak to her on a soul level to help her move through that and support the healing process with the
Oh,
surgeon.
yeah, happy to, happy to. So, every single one of our anatomies, organs has an energetic story. So, you can think of Just as we have this beautiful system of energy with, the chakras, the meridians, the nadis. And for those of you familiar with the chakra system, this is a good metaphor. The solar plexus, for example, is not just a solar plexus. It's connected to stories of personal power and organization of data and how we manage our gut instinct and influence that like center of self in the lower abdomen. The sacral chakra really has to do with boundaries and relationships and how we are creative and express our creativity in the world. Those are, really high level. But all of our anatomies have those energetic stories. Our ankles really support our entire body, 26 different little ligaments in there, little places that support how we take the steps we take and hold ourselves in our journey. The knees often relate to joy. And so for this particular client, at the soul level, she was ready to let go of some of her maternal patterns that kept her small, that kept her from her joy. And the alignment of her knee was actually, our knees typically bend forward. Hers were a little, I don't know the medical term, it's not coming to me right now, but it was oriented, the joint was oriented differently. And it was almost like anytime we see any anatomy or orientation of the energy field looking behind us, it can track to, I'm trying to work something out back here. And in this case, there was perfect resonance with that. There was inheritance of smallness and limitation, very specific limitations around how there was a connection at the soul level to okayness. And she was an athlete. And so there was a part of her that wanted to work this out so she could be fully who she was and enjoy her experience in life. And so, to the question about how we worked together, we did some sessions together before the surgery, getting really clear about what are the energetic stories, what does she know. We started at the before the surgery, we got really clear on what the soul issues were, what the inheritances were. We got really clear on what her perfect outcome was for the surgery. We spoke it to the body. We integrated it into the hara before surgery. We spoke about various sensitivities that she had to medication. We worked with fears and concerns around that. She's a very gifted astrologer, so she also oriented her surgery around an astrologically supportive alignment to make sure that this would be supportive at that level too, which I, have deep respect for. In pre-surgery, we do some alignment work with her own energy system to open all the channels and get, help her stay grounded and get everything open and flowing. Then in the morning, before the surgery, I'll go matrix the team, I'll clear the OR, I'll get, so that anybody that touches her and sees her knows exactly what's going to
Wow,
happen.
really? Okay, so just how does that work? Like, how does a conventional mainstream doctor feel about that when you come in and you're like, "Hi guys, I just
So
out of space."
this particular surgery was done distance. So most of my sessions are remote, but you would be surprised that, I'm just now, I'm on Monday, I'll present to a whole integrative surgical team in Florida about this type of work. I'm engaged with conversations with some surgeons out in California. They are curious about bringing the essence of spirit into the OR because I think they see alignment when somebody is comfortable, relaxed, clear, their nervous system isn't involved. They're able to really receive the operation at the soul level. They might not use those words, but the outcomes are improved. And you can see that in the medical literature, not about soul, but about kind of alignment of intention, relaxation, keeping tension out of the body, and trust, being able to trust the process too. So we do so much inside. With that said, to answer your question also about being in the hospital, because I have been in the hospital, not in the OR. I'm a little, smells are very strong for me. It's better if I sit in the waiting room and do my work and have the person's person there with me, the spouse, the partner. They kind of watch and can see it all happen. But in your patient bill of rights, if you go to a hospital, you always have the right to have your spiritual support with you.
Mm.
And so I become spiritual support. And in your pre-op appointments with your surgeon, you would request to have some spiritual support with you. And you may tell them that this particular person is trained in healing touch, which is an ANCC accredited energy modality, which is ANCC is the American Nursing Credentialing Center, so that I have, that there's some authority or
Legitimized
yeah, it's
in that
legitimized
world. Yeah.
somewhat. You know, I really advocate for being in the PACU, the post-operative, the post-anesthesia care unit, so that when my clients wake up, I am there to help them get the anesthesia out of their field, which then helps the body kind of detox some of that chemical more or the medicine more quickly. I'm there. I go in pre-op with them. I help ground them, hold their feet, whatever we've decided what support is needed. But I'm the last face they see and the first face they see. And because we've walked this journey together, then we do pain management, wound healing, all the energetic things. But the magic, I think, happens in the OR when I'm hovering literally in the room and can feel and see everything.
I love that. That's fantastic. I didn't realize that you could actually go to that level, and a person could actually say you're their spiritual support. So thank you for explaining that, because that's super important, right? It's
Yeah,
actually amazing. And so I understand the technique and the ability to see, to come into the room and not actually be there, but hover. Explain how that happens energetically. So for
sure.
people who may not have ever had that kind of experience, or who don't work in energy themselves, how are you able to see with your mind's eye and go into that space?
Sure. So how sometimes gets into the technical, like the physics and all that. I'm not going to go there because that
Yeah.
just gets so geeky so fast and it's kind of
Yeah.
boring.
No, and
Uh,
don't like it's cool. Like I
but
understand, but it's because it is tangible. It is an actual experience.
yeah,
Real. It's very real. But it's also hard to communicate that or illustrate it to people who might sort of be skeptical of this of
yeah.
work,
So
right?
in those sessions before the surgery, there's one really special one that the client and I set up a very specific place that they feel comfortable. It's their favorite place. It's a place, either an imaginative place or a place in the real world that they feel completely at ease. So we want to replicate in the nervous system the place that they feel most easeful. We set up in that place together before the surgery different ways that they can receive help, like if they're thirsty, because you can't drink anything for
Hmm.
12 hours before you go. So there's often the physical body, the soul body is like parched. So we set up a way for them to receive what they need at the energetic level, much like when you have friends or people that you know who are in a drumming weekend and they're fasting. Oftentimes they will ask me to eat and drink for them. So
Mm.
I will connect with them energetically and I will say, Sarah, this glass of water is for you. I want to send this to Sarah, who is drumming and dancing these prayers and hasn't been drinking. I'm dedicating this meal to that person who hasn't eaten, which we can do as a prayer for anyone who hasn't eaten in the world, and gift what we receive onto another person. And it's in that same spirit, also with explicit permission from the client, that says, I'm going to welcome you absolutely to monitor this procedure, to work with my tissues. It's the same, just as we would do, if you came in with a broken leg and you were sitting on my massage table and we were working to support the tissues of that broken leg and to support the pain management. We would do that, but we do it globally. We're listening to the anesthesia. I'm listening to heart rate. I'm listening for respiration. I'm listening for tissues. And the other thing is, I study these surgeries and I watch them on YouTube, and I learn as much as I can where they're going to enter the body and how they're going to move the tissues and what instruments are going to be used, so that I can track what's happening and talk to the body along the way, reminding it of its perfect outcome.
It reminded me of Lynn McTaggart and her
Yes,
energy work. And then, of course, you've got a quote from Lynn on your website as well. And if people aren't familiar with Lynn's work, she's amazing and works heavily in the space of energy, but not as an energy healer herself, as a former journalist who explores energy and has done huge studies with meditation and how the effects of energy can really transform something very positively with using extremely advanced instruments with scientists in labs that study it, that capture it, and so on. And of course, you've got Cindy Dale there as well. And yeah, both of these women I know from when I worked at Gaia and I produced shows with them. I love that energy is really moving into the mainstream, because this
yeah,
is such an important thing. And this is one of the things that with Lynn's work, she's a best-selling author for a reason. I mean, she's really getting the work of energy out there. But so, is there an accelerated healing rate? Is the client experiencing, so if they have, say, I don't know if you've worked with anybody with open heart surgery or that's needed bypass surgery or anything like that. You mentioned broken legs, a broken leg. But so are they seeing that healing, and are the doctors going, wow, this is unexplained. We just can't believe the accelerated healing here.
we do see that. Here's what we see. So, and I do want to pause and give credit to the incredible surgeons and the surgical team in the medical world who are also in these success stories, because, it's the skill also of the surgeon that's there. So we want to acknowledge that I'm working on some incredible teams. There was one back surgery that I did, supported at Duke University, just close to here. It was an incredibly risky and incredibly technical, as most back surgeries are, surgery. It was long. It was something like 7.5 hours. And there was a lot of nerve involvement, as one would imagine. I just remember for hours sitting deeply in these tissues, asking nerves and tissues to get out of the way, just move up a little. And you can feel where in the anatomy they're working, because you notice, like, you can feel instruments in there, or I can when I'm that tuned in.
Yeah.
And at the end, um, it was perfect outcome, which there were some concerns about that surgery. But in the post-op meeting with the doctor, the first one, he said to his client, I don't know who was in that OR, but it was like the tissues moved themselves.
Wow.
And so I really took that as a data point of positivity, and that there was something happening. But every single one of my clients doesn't have to take their pain medicine as long as they think they do. Sometimes it's just the first 2 days, and then they're on Tylenol. There was a mastectomy that I just supported that was a few months ago, where her drains, was draining fluid, cleared up within 6 days. And they said this should take about 2 weeks.
Wow.
And they were like, wow, you're healing really well. And she was off her narcotic in 2 days.
Wow.
And she was up moving around and taking walks and in a good mood and feeling great. And her scarring is minimal. She's will be going for a reconstruction that I'll support in a few months. But her, I've seen the scarring. It looks fantastic. She hasn't had issues. And so those are the sort of outcomes that I see. Reduction in the need for pain medicine, reduction in swelling, really clean scarring, minimal scarring, minimal
The stitches when we're talking about.
yeah, the stitches
Yeah.
and also, staples and things like that, that everything begins to heal quite faster. Like if there are drains, they do tend to clear up, so there's not a lot of reduced infection risk. And also generally people are happy. they
Mm.
are they are at ease. They don't have medical trauma after being cut open. They have been on board the whole time. So there's a reduction of concern at the soul level. The time we put in at the beginning and the dedication to perfect outcome during reduces, I think, I can say with a degree of confidence that this really supports a good soul outcome and integration at the end.
Yeah, I love that. That's so amazing. And I was just wondering if you've worked on people who perhaps have had multiple surgeries, but you only came in more recently. They had done them years before they knew you. And you're nodding yes, great. I get
Yeah.
that in a sec. But with that, because you just said the healing and the way the body's feeling, could they actually say to you, wow, I felt so different. My other however many surgeries felt like there was it was invasive and I can still almost feel that in my body versus
Yes.
this one with you. Okay.
Yes.
How they explain that. So something like, and what made me think about that, I have a friend who broke a collarbone and he still complains about that.
As you were asking that question, I was reflecting on a surgery I was supporting with a client from Washington D.C. who had it was an ablation, but she had a lot of sexual trauma.
Mm,
And this was not the first that she had done. And, to take fire into the womb space, that is a very challenging orientation for the body. And this particular surgery really, it hadn't been successful. They wanted to repeat it. They repeated it. It it helped a little, but not a long time. They wanted to repeat it. She said, "This is the last time. I did see benefit, but I want your help." And
what kind of surgery was it?
it was a uterine ablation.
Okay.
Was a uterine ablation, and it was in an outpatient surgical center. And she was awake from her anesthesia in like 15 minutes, perfectly clear, no pain, ready to go. And the nurses in that, and I was actually there with her in the at the surgical center, and they came and got me and said, "We don't know what kind of miracle stuff you've been doing, but if you could do that to everybody here, our job would be so easy. But more important, my clients had perfect outcome. She's
Mm,
had perfect outcome. It completely supported her. She was so grateful to feel okay in her body
mm,
after. And feeling okay in your body is exactly the orientation that one can heal from deep wounds.
mm,
In this work, I may be quote, in quote, doing a lot, but it is always the client's healing. We just hold space and try to create the right relationship for healing to happen. So we just create a really robust, very specifically architected space around perfect outcome. Give the tissues what they need, talk to the body, work with the medicines, and the body knows what to do. So for her to say, "Oh my God, I feel okay finally in my body," that's healing.
mm.
That's where the magic is. Yeah, she got out of the OR with flying colors and no pain meds needed, but the
Yeah,
healing is, I feel okay in my body.
beautiful. And leading up to this and afterwards, do you give your clients practices to do so they can visualize or, just any way to sort of sit with themselves once they're done, once they've completed maybe working with you directly and the surgery?
So we have a whole post-surgery sequence that we do. So the work continues on after, and that's dictated by what the body's needing after the surgery. So I typically stay in pretty close contact with them the day, 2 or 3 days after the surgery to see what's needed if they're having pain. Let's do some pain management. If you're not sleeping, if the medicines aren't being supportive, let's put some light around them, see if we can get them resonating more, the language of the medicine in your body. Let's see if we can get them resonating at the same frequency by using intention. There's a session pre-surgery where after I've studied the surgery, we go together and we create what I call micro intentions. And this would be definitely on the heels of Lynn McTaggart's work, where you're asking for perfect outcome for this part of the surgery and for this part of the surgery and for this. And so we work on those intentions together, and then I give them the intentions that they've come up with for themselves, a list of those so that they can meditate and let them go through the consciousness and the energy system. And, that work is for them. And after, in terms of practices or affirmations, it's really dictated by what the client's goals are. So we do a lot of self-holding, kind of teaching them some healing touch techniques. I will sometimes teach their partners some things to try. The other thing that I think runs through is just the empowerment piece of helping somebody ask the right questions of their nursing team and their surgical team. And then I wouldn't say I know all the questions, but I've had enough experience now that I think of a lot of questions that people don't typically ask. And it just depends on the surgery, like what type of mesh is going to be used and what is the percentage of success with that versus this other one. Surgeons love to talk geek with us, but what I have found is that they also don't, they want to meet us where we are. And most people aren't educated in the technical pieces of their surgery, nor do some want to, because it takes a lot of courage to meet a surgery at that level. But I ask my clients, would you like to know a few questions that I might ask after reading through and studying and watching this surgery? Some say no, I don't want to know. It's fine. I trust you. Some are really curious. So that can be helpful too. There's a woman that I'll be working with, and through the conversations and coaching, and of course in alignment with her medical team, because I am not a doctor, she has sought out some second and third opinions in other states and found that the surgery that she was scared to do, that something in her body said, I'm not resonating with this. She found a laparoscopic surgeon. She found a surgeon that does it laparoscopically and resonated with it instantly. And it was that conversation that helped to empower her. If you're not feeling right about this, have you researched it? Are there other ways? Are there other surgeons somewhere else? Because surgical technology and surgical perspective, it changes. I had an ankle surgery, a reconstruction done last year, and sought out a surgeon that invented the laparoscopic version of a fairly significant surgery. But people don't know how to think about that. They just think, well, I got the surgeon's name from my PT or my doc, and they seem like they're really good and they've got good reviews, and that's it. But every surgeon, just like each of us, meets their profession in a totally different way.
Yes, yeah, 100%. You've got to feel into that,
Yeah,
we can say the vibe of it or the energy of it, but just your body does give you a
yeah,
sense,
exactly.
right? There's like I don't want to call it a warning, but you definitely get like a reaction to
Yes, and
the
I just
situation.
really
No,
trust
no,
that.
100%. Yeah, me
Yeah.
too. And how lucky for your body that you got to be doing your surgery, right? Like your healing right on yourself.
I know. Well, that was a creepy surgery for me because I didn't have me.
You did have you though, but I guess
Well,
you were out, right? You have to be okay, so you didn't
I
have
mean,
the
I was
distance.
completely anesthetized for two
Oh,
and a half hours. And, and I think part of this is kind of interesting. I see a Vedic astrologer from time to time, and she looked at my chart one day and she said, this is really interesting. I never saw this before, but the energy medicine that you're supposed to be doing is in a hospital. It's very clinical. And I was like, oh, that is so interesting that that came up now as I'm really developing more awareness of this particular service, or that this is possible.
yeah.
And I haven't done that. It's taken me about 8 or 9 years where I felt like I now feel very comfortable with my history. And so until I did that, I really didn't want to talk about it too much. I just was like, still. So I thought that was really interesting timing, as if the universe was saying, it's time.
Mm-hmm.
Just, show the world this is possible.
Yeah, I love it.
So I thought that was
And
kind of cool.
it is really cool. And I mean, I also see a Vedic astrologer, so I totally understand when things show up in your
Yeah.
chart. And so I was wondering, well, actually, I'd love for you to just explain the difference between psychic surgery and what you do.
Yeah. So the way that I understand psychic surgery is that a practitioner will actually psychically do the surgery, that they actually go in and move tissues and work with the anatomy in that way. The way that I do it is I let the surgeons do the physical part because that is their expertise. And I work with the energy layer, the spirit level, the soul level, because that's my expertise. And we marry our gifts together in this confluence of collaboration in the OR, and we'll work with the medicines because that's a dense energy.
Mm.
It's a dense energy. And so they're working with the physical part and I'm working with the energy part. So we're partnering. But in psychic surgery, I don't believe that there is an actual physical. I mean, I want to be careful. There is a physical aspect because we're only one person. We're just you know, um, it's not like the spirit and the physical is different. They're just different frequencies of the same being. We're only one being. We just have this range of frequency. In in psychic surgery, you're really working from the spirit frequency down and hoping that it shifts, it's fast enough, clear enough, strong enough to shift the denser relationship to that, or
Yeah.
but for me, we're partnering with the same intention of perfect outcome, and we're going at it from both sides. And I think that's a difference.
Yeah, no, thank you. I felt it was just important to clarify how you work. My understanding of psychic surgery is similar to yours, that it's a practitioner who, and they're not doing it remotely. They actually have the client come in and on their maybe a massage type table,
Uh-huh.
but they're not using Reiki, but they are perhaps having their hands near around or feeling into energetically around the person, and then with your eyes closed are able to kind of go into that realm, into that other world, and operate in a sense, in quotes.
Yeah. And I
So
think maybe it's very similar to what I do, like in the exposition of talking about that back surgery. Like I'm very much in the body,
yeah,
paying
and,
attention. And
and I
so
get that.
maybe that's a little like it, maybe, but um, I don't know. There you
Yeah,
go.
it's and it when you describe being in the body, like I totally get that, because when I work with my clients, I see there's a component of when I'm working with my clients where I'm seeing I'm given access to being able to see where
Yeah.
stored stories are within the body. and how that's been manifesting, and if it and it shows it presents itself depending on what it is. And I call it the smog of sorrow, because we're like, I
Oh,
literally
yeah.
name it as this heaviness. So say an example of somebody who might be really heavy, holding trauma from their childhood, as a lot of us do, but very specific trauma, that they have bottled it up and they're keeping it locked, contained in their heart space, and feel very blocked or not open. A manifestation of a box or a cage or some type of container that's holding, keeping them safe,
Yeah.
is there and presents as iron, energetically as iron, and then that has to be dissolved. But then after that, there's sort of this smog of sorrow, which presents as a very smoggy, dark, gray cloud, not black, but almost, that has to be cleared and lifted and removed and dissolved back into loving awareness. And then I can see how that's affecting different things,
Yeah.
but I'm not getting so. My gift isn't to see the finite, like the muscles and the fascia and the bones and things like this. But I'm able to see, like, literally like, the whole pelvic region, for another example, or kneecaps, or just and it shows as golden, not gold, it shows as an orange distress, almost like a heat in the body, that there's an issue here and it's being stored here. So I understand, how you can, I can visualize how you would be going deeper, how your gifts are really presenting as actually seeing, and then watching videos on YouTube, you're getting a sense of, not to become a surgeon, but you're actually, for your
No.
own informative, your own information. You kind of need to know, okay, what's happening in this surgery, which I would imagine is kind of gross to watch in a sense. Like,
I love it.
you
I
love
love it.
it. I'd be a bit like,
I
oh, I don't want to be watching all those tendons and the open heart things being sucked, moved around and whatever. But I understand how you kind of need to be diving into that space, because when you're in there and you've got you're doing with your eyes closed up, I'm
yeah.
imagining, because you're stepping into another realm that's giving you access to this ability, right? Yeah.
Yeah, it's really
You're
interesting.
like literally going,
No, exactly, exactly. And the way that you're tracking energy too, with these incredible metaphors of the cage and the color, depending on who I'm working with, sometimes these sort of visual metaphors, it's just it. I don't want to say it's just energy, but energy expresses in so many forms.
mhm,
Sometimes, you'll see a bird fly out of the knee, and it's like, oh, cool, take with, so you are working in this like imaginal, incredible imaginal energetic conversation, and it's like whatever needs to happen, I'm open for it. i
mhm.
I trust the body's wisdom, and if it needs to let a bird fly out, then perhaps it's carrying that old ancient story, or perhaps it's giving a little air and oxygenating the space. I don't need to know the specifics. I'm just there with a very, very solid intention that's been crafted by my client that says, this is what I want to have happen.
Yeah, I love that. Well, why is it important to work with someone like yourself to support the healing journey and the whole surgery experience?
Well, to be honest, I think surgery is terrifying. And I don't like to sell fear. I'm not a fear seller. But it is a big journey to go from knowing yourself in one way, falling asleep for a few hours under the care of someone else, and relinquish a lot of control to humans. It's how I feel in an airplane. It's like, oh my God, there are imperfect, perfect humans flying this plane. It's a total surrender. And then, unlike an airplane where you get off and you're kind of the same person as you were when you got on it, something has changed. It's usually painful. There's stories beneath it. Oftentimes, you will be left with a scar, or maybe your body altered in a way that you maybe didn't really. Some people really don't want a surgery. The person I'll be working with in December really would prefer not to be going through this. I felt the same way. I did not want a new ankle, but you know what? I understand now why I needed one. I'm walking my path totally different, and this is more supportive. And I'm, oh, okay. this was almost like a physical soul change before the spiritual soul change caught up. Oh, I needed that. So to have support along the way can help, I think, help you align with transformation instead of being more reactive and responsive to transformation.
Mm.
It allows you to be more in the process because you have somebody else holding you in the process itself, and you have somebody to talk to that understands that you are a sensitive, energetic being that has a spirit that wants to be included in this life-changing thing and that can doula you through
I was just
a
thinking
dark
you're a
night.
surgery doula. I was literally just thinking you're a surgery doula.
Yeah, maybe I heard you, because I don't ever use that language, but I was like, oh, that's good. But, it's really like that to have a spiritual partner in a very spiritual experience that has, I think, up until now, really been relegated to the realms of the physical. And as we continue to evolve as a humanity to be both more integrated and collaborative as at the collective level, so too we are looking at all the different ways in the microcosms where collaboration and unity is becoming more needed, wanted, expected. Like, treat me as a whole being. What does integrative care look like in the surgical model? These, I think, people are looking for. Wait a minute, I deserve this. I want this.
I think it is really important. And I was actually just thinking also of the hara. Isn't
Mhm.
it can we compare the hara to the torsion field where we have this beam, the light that's coming through, but also the expansion of the energy that's literally kind of, I don't want to say coming out like concentric circles, but if anyone wants to understand what the torsion field looks like, it's kind of like that beam of light coming down through our central column, our central core of our body, and then well,
Yeah.
circles coming out of that, going up from underneath through your body up and out. Do you work with the torsion field ever or at all during surgery? And what is the torsion field?
Yeah, so I don't work with the torsion field specifically, but I think that it is made possible because of the hara.
Mm.
The hara is what brings us here, organizes our energy. It maintains that direct axis of energy from, our spirit to Mother Earth, which then that flow, it's sort of I think the toroidal field, that's how I always knew it, um, is sort of an expression of the hara, like a natural expression of the hara. So the way that I don't work with those alignments specifically, but we do use the hara throughout the surgical process. And we use it in pre-op when we are supporting the knowledge of the soul to know itself and to know its body and to get the soul involved in the conversations of perfect outcome. The hara is really important post-operatively. So in the PACU, whether they're present or over distance, re-anchoring the soul in the new body is so important because the body has just been through something, and it's like, well, let's align the essence of you with the new so that you can feel like a full whole being as you're healing. And I actually think that's why we get the results that we get, because the wholeness of you is on board at a vibrational level.
Yeah.
And then if things come up post operative where you look at yourself in the mirror and you just don't look like yourself. You've got drains hanging down, you've got scarring and bruising that's turning purple. The hara wavers with that. The soul doesn't know, so we re-anchor it. We re-anchor it. We re-anchor it. We re-anchor it
Mm.
until you go, oh. And I have this beautiful clinic that's low cost that people can go and get their hara worked with. So a lot of my surgical clients will have me, stay with them and kind of doula them to use that after the surgery. And then they'll stick around for a few months of clinic. so that they can just keep that conversation, self and soul, self and soul.
Mm.
I'm okay. I'm okay in my body. Continuing to make that the conversation that's like bolstering and supporting their healing.
That is so beautiful. Amazing that you're offering this service. It's great. I have one last question, and I just
Sure.
wonder if you've ever seen in a moment where the surgery was perhaps not, looks like it was going
Yes.
in a bad direction, and you're seeing the soul like having a near-death experience potentially.
So I have actually that friend I was telling you about that kind of came along. I think that knowing him was part of the preparation for this work because, like, he's not a client, he's a friend. It's been a long time. He's been with me a long time. There was a knee surgery that he was doing where I was holding his feet, and this was before I knew a lot of what I know now. I was just using my healing touch, and all of a sudden I couldn't feel him anymore.
Oh,
And I was like, wait a minute, where'd you go? Where'd you go? Where'd you go? And I kind of tracked and I felt him out there and I said, are you sure you're ready to go? Back in the body.
wow.
And who am I to tell somebody to get back in your body? Somehow I knew that I needed to privilege his choices. But at least I asked a question. And I don't know what would have happened. I don't know if he was just up there checking it out. That was actually my sense is he's a really curious person. And he had an opportunity to slip out and was like, well, let's see what this is all about. And then the question, are you sure? I thought it was very interesting that I offered the question and then I could feel his energy back in the body. It could have been just his own timing and his own choice. But it was interesting because he did lose consciousness in
It was
the
reflected in
OR.
okay, so they saw that. They saw
Yeah,
him
they saw that
operate
and they
and
needed
breath.
to do the anesthesiologist had to make some adjustments.
Well, thank you for sharing that
Yeah,
story.
you're welcome.
Just the wow, that's interesting to,
It is, I thought it was really interesting too. That it only happened that one time, but this particular person has taught me so much. And so now I know to ask the question. That's just I'm listening for that.
yeah.
I want, that's our goal is to make sure your outcome is perfect, which
It
would
is always for the best and
necessitate
highest
you
good.
being here to do
Mhm.
that. And I kind of joke and say, well, I haven't lost anybody yet, which is
It's true.
not something I would put on the website, but it's just something I'll tell people casually.
You don't want to have that as your headline. Because
No, no.
no, I love it. Well, this was such a great conversation. Is there anything that you think we missed here that you want to share? How do we find you if someone's really interested, is about to go into surgery, or it's coming up in a few months? How can they find you?
Oh, thank you. So I have a little website dedicated to this work. It's called energymedicineandsurgery.com. There's a little intro video from me, but basically, I would love to talk about your surgery and whether it's in a few weeks, a few months, or a few hours. Some people call me when it's an emergency and I clear everything. My surgical work is the most important. It's so important for people to get this type of care in such an important time. So I like to have a conversation and then we'll do like a buffet sort of invoice, which is sort of fun. It's like, I really want this support. I don't really need that one. I really like this one. Oh, I've got an energy person for after. So we just try to really architect support that feels right. So you can find that in a short course on tapping for surgery to help discharge energy on that site.
No, that's cool. But we can also go to ameliavogler.com, and on your main site, you've got a link. You've got other links to your institute where you teach people as well how
Yes,
to do energy work.
yes, 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 you can do that.
Thank you so much. It's been
You're
such.
welcome so much. Thank you so much for listening and for sticking around for the whole hour. Appreciate it.